My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative Show. Welcome to Port Elizabeth. Kabeja. We are back. We are bringing you a common one. When I say common one, it's a condition that is touching almost every family, where there are older people or even younger people. And we are talking about arthritis. So that's what we're going to be talking about today. And as usual, we're going to be talking about this topic from our own perspective, the alternative perspective. Make sure you don't miss it. And hello.
Hi viewers, welcome back on the show today. Thank you for tuning in. As usual, I'm back with my questions and Thembi is here to answer on it. Stay tuned. Thank you.
Arthritis is a torture. For those people that are suffering from it, they will tell you. Some of them, you don't need to hear anything. You can just look at the agony that they go through because of this pain, particularly in winter. What is arthritis? Who is exposed to arthritis? Why is it so common? Was it this rife in the olden days? So for this topic today, I've prepared this clip for you before we dive into the question. So please take a look.
Arthritis, a household name in almost all families in urban areas. There are different types of arthritis, but the most common type is osteoarthritis, which is wear and tear of your joints. Is it wear and tear that is linked to lifestyle and environment? Is it genetic, or is it badly misdiagnosed? Why would people in urban areas suffer the most, while people of the same age in rural areas escape this? They are more active, walk long distances, work in the fields, and with all that activity, you would expect more wear and tear. Something is missing, and until medicine looks at it with a different view, unnecessary suffering is going to be the order of the day.
Welcome back. As you can see, arthritis is not only limited to one area or like the wear and tear of joints. There are so many other factors, and there's so much misdiagnosis, and there are so many possibilities of fixing it. So we're going to be looking at various aspects of it today and see how we assist you, our viewers. So please, over to you, Lorica.
Okay, thank you, Thembi. Arthritis is known as a chronic illness, which is associated with age, meaning wear and tear. Is it age-related?
Yeah. Firstly, it's chronic. So when it's chronic, it means you are in it for the long haul. You know those conditions where you find they say you're just gonna have to learn to live with it, like the blood pressure and the diabetes. So arthritis or cholesterol and all that. Arthritis falls in that category, because most people who suffer from it never come out of it. Whether it is because medicine or conventional medicine does not know how to deal with it, or it is because it really is a condition where you cannot come out of it. That's what we're going to be discussing in our show today. Firstly, coming to your question, is it age-related? Yes, it is age-related. Because the constant subjection of friction, because remember, as you just take simple walking. Walking involves a lot of different systems, and the limbs are part of that. Or even holding something or throwing something, you're using your joints. So the reason God created the joints, it's because they're supposed to flex. And that is the case with every part, okay, whether it's the neck or it's the waist or it's the joints. So arthritis is not necessarily only limited to knees and hips and fingers, as is the case. It's just that those areas seem to be the hardest hit. But it is wear and tear, but it is not only wear and tear. It is wear and tear because the constant use, remember, even everything is meant to wear and tear. The shoe, you wear it for all that time, then it's animals, plants, they die. That's why you've got seasons. You find that you use them, then they wear and tear. Those that you have not taken off the tree, after a certain season, they will wear and tear. So and then you start again. So wear and tear is a natural phenomenon. It's a natural process that's created by God, because in any case, we, just like human beings, just like plants or animals, nature has got life and death. Yeah. But the process between that life and death is something that is progressive. You find it's not like you know. So arthritis, therefore, does involve, to a great extent, wear and tear. It's age-related, because you've been using, you've been walking, you've been touching, you've been using those limbs for donkey years. Okay. Therefore, they are going to deteriorate, you know, and they start to wear and tear, and eventually then you experience what comes with it. Now with arthritis, there is cushioning. Arthritis has got because you find that the joints have got the upper and the lower joints. There's always two joints coming together, whether it's the finger or it's what, but the joints, like it says joints, there is a joining that's occurring between two separate bones. But these are cushioned by the cartilage. Okay, that's a natural, it's the pillow, the natural pillow that cushions them so that they don't rub off each other. Also, there's synovial fluid, which lubricates, you know, because like anything, even a car, you find the car has got oil that must lubricate, you know. So if it's dry, then you find there's a lot of friction that occurs. So there are a number of things that are created by God that help in cushioning those joints. But now over the years, you will find that then they start becoming thin and thin and thin. You lose the fluid. I mean, there's so many other things that will drain the fluid, the synovial fluid. So there are so many factors that cause the wear and tear, which are linked to aging. Okay, therefore, that is why it is part largely is age-related. It's wear and tear. That's now one type of arthritis, you know. But then you will find there are other types of arthritis where you find, or let me not say only arthritis, because you'll find that the tendency with conventional is that once you have a joint pain, the assumption is arthritis, particularly if you are an adult. I mean, you are an old person. It's expected. So you'll find that they tend not to even investigate what could be. Once you say, hey, my knees, then of course you need to have a replacement. Now the replacement is a fictitious provision, something that provides, the same function that would be provided by the cushion. But now it's an artificial thing that you find is created to provide that function. But the tendency is that once you say, I've got joint pain, and you are in Makulu or you are a Tatumkulu, so there's no need to check, is it warranty? Is it really warranty? Is it arthritis or is it? The assumption is that it's arthritis. Then you get given the medication. And remember, pharmacology, pharmacy. Pharmacy has got medication that's pre-created and that's grouped. Like if it's inflammation, you've got a group of medication, that's drugs that fall in that category. So your doctor will just select which one he thinks, but all these are for inflammation, all these is for arthritis, all these is for the heart, all these are for blood pressure. So that's how pharmacy is created. It has got grouping. That's why you find a doctor can just walk in. A doctor can just say, this is because they get given this information, that these are the drugs, these are the new ones, these are the side effects, so you can just suck that out of this list, I'm going to give this one. Okay? And then if the person is responding badly, then you change, you give another one. But from the same category of arthritis. So that's what happens there for that. When you walk in and you say, I've got joint pain, and you're looking Makulu or Tamkulu, you get given the medication for arthritis. So, and you may very well be suffering from something totally different. Okay, so that's one problem. And also, like I'm saying, there are so many other things that damage the joints. So many other things that damage the joints, which I will make reference to as we go along in the discussion. But limiting my talk just to your first question as to, is it age-related? It is largely age-related, but it is not limited to age. Hence, you find young people that are on medication for arthritis who may not necessarily be suffering from arthritis, but from these things that I'm going to share as we go down with our discussion.
Okay, thank you. I know of young people that are suffering from arthritis. How does this occur in young people?
Okay, as I've said earlier, that it's largely age-related, but there are so many other things that cause bone or joint problems, not necessarily arthritis. So you see, I'm saying there are so many other things that are causing joint problems. I'm not saying arthritis. Okay, I'm going to mention a few because I've dealt with. I even mentioned one lady in the past shows where when I saw her, I saw that she had leukemia. Okay, and I decided I was not going to treat her because she was not experiencing serious. She was not sick as like in sick when she walks in, which is something that you would expect for someone who's got leukemia. So now when I start treating and she gets sick, then it's going to be like it's the medication that's made her sick. Meanwhile, I was poking the boil, because she's sitting with the boil. She's not aware. Me, I burst the boil, and then all that pus that comes out, then it's going to be like it's me who's causing, it's the medication. So I was not planning to treat her. But I just advised her to take the supplements as a way of getting out of creating a situation that's going to make them say you made her sick. Meanwhile, when she came to you, she was not sick. So I thought, okay, let me just give a range of supplements that she must take so long, and then we take it from there.
Okay.
Which is, but I never gave her the prescription, the medication. But after a month, because I said take it for a month, then we can see what happens. So after a month, she calls and she says, I can squat. I did mention this in the past shows. And she said, I am actually shocked because since I was young, she was now in her early, I think she was 31 or something like that. She said, I'm known that whenever, even if there are exercises in physical exercises that are done at school, at high school, I would be excused when it comes to squatting because I was known I cannot squat. But she says, I am shocked that just by taking these supplements that you prescribed for me for a month, I can squat. And she said I discovered accidentally, because it's not like I tried to squat, because it's not something that I even go there to, because I know I can't squat. But for some reason, I found myself accidentally, I found myself squatting. And then it's like I can squat with ease. So she was shocked, But now when you cannot squat, you've got joint problems, you've got joint pain, you've got arthritis at an early age. Meanwhile, she had leukemia. She had bone marrow cancer, which had not been detected yet, but which was growing with her. So, and in the treatment that I'd given her, there was nothing for arthritis, But I gave, even in the supplements, I gave her the supplements like the vitamin B12, which work, those type of supplements, vitamin E, and, which work inside the bone, in the bone marrow itself. And that assisted her skeletal system. And then she managed to squat. So what I'm saying, therefore, is that young people who are suffering from joints are not necessarily because of wear and tear. It's because of other serious conditions that are not detected by conventional, and therefore they're just grouped in that category, especially people who come from families that have got a history of arthritis. Then they will say, because my mother is a serious sufferer, so they said I've inherited that from, it's just that it has started early with me. So I get a lot of such explanations. So bone marrow cancer, be it leukemia or lymphoma or myeloma, bone marrow disease, cancers, they affect the bones a lot. They don't just only affect the joints. You'll find a person may say, sometimes when it's cold, I feel the cold inside the femur, inside the bone. It's like inside my leg. So you'll notice that people that have got a bone marrow related kind of issues, it's not necessarily only limited to the joint. It will go down to the bone, or even the thigh. A person will say, hey, my thigh, that type of thing. That's one type. But also people that suffer from serious hemochromatosis. That will affect both the young and the old. Hemochromatosis is a genetic iron overload. Now remember, iron it transports oxygen. We get it from food, it's stored by the liver. But when you've got hemochromatosis, you find the liver struggles to maintain the right balance of iron. Then you sit with a lot of it. The small intestines, they absorb a lot of it. The liver cannot manage the levels. Then you sit with a lot of dumping. But now iron is corrosive. It eats where it is dumped. It's the liver that's meant to store it. But if it's dumped in your heart, you will wonder, why have I got serious heart issues and that heart is just packing up, and your doctor may not even know why. They may be aware that you've got heart problems, but why, they don't know. You may have serious pancreatic issues. You may have diabetes that's shooting up because that pancreas is buggered because of iron that's dumped. And you may have joints. You find those people where you find even the fingers are deformed and they cannot, young people where you find even the way they walk, they like deformed, the ankles, the whatnot, and they say, it's the serious arthritis. It's not arthritis. When you've got serious hemochromatosis, it will finish those joints if it is dumped in the joints. So that's one other condition that I've found as seriously misdiagnosed. And one problem with hemochromatosis is this. When you've got iron overload, this kind of condition, you've got to avoid vitamin C supplements. You've got to avoid taking vitamin C supplements. But then it's actually the opposite that happens, because now you are known that you've got arthritis and now it's winter. So you must take more of vitamin. You find it's even your doctor who's recommending that you must take vitamin C because it beefs up the immune system. Then you cannot, cold will not affect you that much and all that. Meanwhile, that vitamin C supplement is actually killing you, is making you worse in terms of keeping that, absorbing that iron. Because vitamin C helps with iron absorption. So when you're taking supplements, you are toast. And you keep on gobbling vitamin C, you're taking all these different types because they say, it's winter. Some people are even taking the vitamin C, the injection and all that, because you beefing up your immune system. When you've got hemochromatosis and you're taking vitamin C supplements, it's going to finish you. Your arthritis is going to get worse instead. So, but you must be able to detect it. You must be able to detect it. And it's not easy for conventional medicine to detect hemochromatosis because it needs special tests, liver tests. So that's another condition. Now the third one that I've found to be a problem also for conventional, it's scleroderma. Now scleroderma also creates deformity that is almost similar to hemochromatosis because it's the connective tissue. Now when the connective tissue is, now remember the connective tissue, it holds the framework of the joints together, or even organs, not just only the joints. So now when that is disintegrating because of the scleroderma, then you find you get deformed because the connective tissue that's supposed to hold that part together is, then you're going to have serious issues. Not only serious issues in terms of just the pain, but the fact that the connective tissue that's holding together is tearing, is disintegrating. So there's nothing that's holding together. So that alone also is pain, is also. So there are those type of things. Also the glycogen dumping, I've mentioned this in people that have got Arthritis disease. They end up having issues with kidneys because of the glycogen dumping. So when you've got glycogen that's dumped in your joints, I promise you're gonna feel the pain in that particular joint because it's toxic. Even the kidney that ends up receiving that glycogen, because it's the body tries to eliminate it, that kidney is gonna go. But then what happens with the kidney? When you're having issues with the kidney, amongst the functions of the kidneys is to do what is called electrolytes balance. And calcium is one of those electrolytes. So when your kidneys are battling to manage the levels of calcium, then your calcium is dumped anywhere. So when it's dumped in the joint or wherever or in the tissue, you're gonna hear it. You're gonna feel it. I had one gentleman from Pietermaritzburg, and he came, we're still in our previous premises, and he said, I was walking in the mall, and that's when I decided I was coming to you, because I'd been planning to come, and I had planning to come, and then because then money doesn't, I try money is not coming together. But I'm doing other things which I could put on hold and attend to but he says, you know how it is. But he said, I was walking in the mall. They had to come and carry me, because all of a sudden, the pain, I could not even walk. The pain was too much. And he said what was annoying is that when they take me to hospital, because they had to take me to emergency hospital, so they gave me the injection. But she says the injection just numbed the pain and it was better. But now when they're doing all these tests, because he said they did all kinds of tests, blood and x-ray and whatnot, and they were picking up nothing. And he said I got so angry. But then I decided, if they're looking and they can't find, what do I expect them to do? And he said, that one that I had when I was working in the mall is what made me to decide to come to you. And he had a huge calcium crystal, a huge one. So that is why the pain was unbearable. So things like that. So like I'm saying, now that's from the kidney. You can have calcification because of your thyroid. If your thyroxine levels are not on the low, and so it's not processing calcium well enough, you will have calcification. Or your kidneys have got issues. But all those things you must be able to pick up before you say you have fixed this. Because you may fix, then it keeps on feeding. So there's quite a few things conditions that cause and that will finish the joints, both in old and young. And if you have not nailed the cause, that person is going to be crippled, I promise you. Let's go for a break. When we come back, we continue with the discussion.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adelase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are talking about arthritis, which causes a lot of suffering for many people. And the part that usually concerns me the most is that people are doing lots of knee replacements, hip replacements. To some extent, it works in some people, but in others, you find they end up getting worse than they were before. But that's what we're talking about today, to see why. Is it because of wear and tear, or is it because there are other causes, in which case we would look at those causes so that we go back to fixing where the damage is already done.
Okay, I just want to chip in quickly. I know my father was complaining to me that he has the severe back pain and then down his arm, but now with him is when he lie down, then the pain is very, very, very severe. But when he sit or walk, there is no pain. To the extent that I even went to him and gave him some money because he said he wants to buy arthritis medication and all that. But now I want to know, is that leading to arthritis?
Now, when he lies down on his back or when he lies down how?
Like when he goes to sleep on his side,
On his
because
side.
he normally sleeps on his side. Due to also the pain, then he will use like a continental pillow instead of a standard pillow. He uses a continental pillow to sleep on.
Okay. But when he's sitting, he does not feel the
He
pain.
doesn't disturb him.
Okay.
That was now so funny for him.
Yeah. But now when he's sleeping, does it feel the pain together with the arm pain?
Yes, it
Okay.
hooks him at the same time.
Okay. Now, of course, you know that the symptom can mean a lot of things. Yeah. The symptom, it doesn't mean because he's got that symptom and it feels the pain. You say he feels it on the back or on the side?
On the back, it comes
Or when
from
it's-
the back, yeah.
Okay, but when he's lying on the side.
Yeah.
Okay.
And what his age is, 72, yeah, 72 years.
Okay. Now, like I'm saying, that there are so many things that would actually cause. It's not necessarily a bone pain. Okay. But you see the arm, the arm. Let me say the upper body. The upper body has got its own feed, its own arteries that feed it, like the brachiocephalic arteries and even the subclavian veins that bring the blood back. Now, when there is an obstruction that obstructs the blood flow,
Okay.
you will, particularly with the arm, because now when you say he actually even feels in the arm, because that I would link to the blood flow that is servicing the upper body. Okay, that's now your brachiocephalic arteries, that even your subclavians. Those are blood vessels that are servicing the upper body. So the fact that you find that when he is sleeping, he actually feels more pain than when he is sitting, because that's linked to that. You remember people that have got heart issues. You will find that they will say, when I go to bed, when I sleep, my heart, the ailments tend to come the most. And they say even when I get up in the morning, I find I need to loosen up before I can walk. Because the heart, when there's an obstruction, that flow is not happening well. And I think that would be an obstruction in your brachial, because your brachial services the arms, it services the neck, it services the head, it services the face. Not necessarily the brain, but the head, you know. So when you are lying, therefore, you are actually forcing, you are actually, in fact, I would be curious to know if when he's lying on the left side or when he's lying on the right side.
He normally sleeps on his right side.
Yeah. So, but which arm is sore? Is the left, when he like, yeah?
Yeah, it's the left arm, because he sleeps on the right side.
Okay.
Yeah.
But when he sleeps on the left, does he feel the pain on the right arm?
Because now when he feels the pain while he's on his right side, he then now turn, but then the pain is still moving together on that side.
So it's only the left arm, whether he sleeps on the right
or the left,
or in the left, but it does not affect the right arm. Okay.
He only complained of the left arm.
No, that's not a bone problem. That's a blood vessel problem. That's an artery problem. And like I'm saying, it's very likely to be the brachiocephalic artery, which is the blood vessel that pumps into the upper body, you know. So that's not a bone. That's not a bone. But then the pain is in the arm and in the back.
In the back, right from the middle.
Upper part.
Yeah, up, down.
Or does it go down the spine?
Down the spine.
All right. Now, I would have to check there, because the spine controls the nerves. For a person to say "Aina" to feel the pain, it's your nerves that sends signals. That is your central nervous system, and that is serviced in your central nervous system. Your brain and your spinal cord sits with a lot of nerves. So that's why you find people may be involved in an accident, then you'll find they were not bumped on the limbs or anything, but then it affects but they are bumped on the pec, and then the limbs they cannot work, and they are limp or they are what. So that's the neuro, but that's something different. So I don't know, in his case it sounds like two things that would happen.
Yeah, it's actually very complicated, but he was really complaining seriously. He's not the person that does complain.
No, but with the scan I would be able to see.
I will try and perform.
Yeah, with the scan I would be able to see what it is, but the back, that would link to the neuro, which connects to the limbs.
Yes, yes.
Okay, because remember, the neuro connects to the limbs. That's why you'll find people will have spinal issues, spinal injuries, and then they will have serious neuropathy, what we call peripheral neuropathy, where the nerves at the feet and the fingers and the end, they are totally messed up. That's the spine. But the fact that he's only feeling it on the one arm is not only limited. That is why I say brachial. The brachiocephalic artery would also have something to do with that. So it would help me to scan him to know. Then I would be able to tell if
so it's nothing to do with arthritis.
No, it would definitely have nothing, because it's remember, arthritis as joints. Yeah. It's wear and tear. Although people with osteoporosis, okay, now people with osteoporosis, because osteoporosis is when you lose the bone density. Because remember, the bone density is the thickness of the bone. Like you see the bone of a chicken, you can chew on it. But the bone of a sheep, of a lamb, you can never put it in there because it's hard. It's the density. That's what makes the difference. Okay. But now when you lose the bone density, which is what is called osteoporosis, then that may affect the spine, and that may lead to, but then you find that people with osteoporosis, it's not just only the pain. You might find they become short. You find the person had a normal height, but you see a few years, it's like, have you shrunk? Because they pull, or they bend. You see those people that have got easy how is it?
Africans.
I'm asking your father, is he?
No.
Is straight?
He's straight.
Yeah, so, but osteoporosis, which is the loss of bone density, would affect the spine. It affects the spine largely, actually. Yeah. Yeah, so, but I would know for sure what is the case with him through the scan. Okay.
Over to our next question. Many people who suffer from this condition believe it's a lifetime dependency on medication, to be specific. So they will never be off it. Do people ever get cured?
Yeah, that's the belief with chronic conditions, that once you are put there, you are in it for the long haul. The question would be, what kind of arthritis have you got? Because if it is wear and tear, meaning you've lost the cartilage, that pillow that is cushioning the bones, the belief is that's it. The belief is it can never grow back. That's, I mean, one client told me that, and they even showed in the x-ray that this is it. And once you've lost it, you've lost it. So when I said it can actually grow back, she did not believe me. But it grows, but it's a long and tedious process. But it does grow back. Why? Because remember that when we were covering, for instance, that episode on medicine, I mentioned that one area that informs alternative medicine is that the body is naturally equipped to heal itself. It's equipped to heal itself. So you just need to know which drawer you need to pull from to give it what it wants. Then it's going to show you. So it can, such that if we were to have big pockets of money as alternative, we would actually prove, because we would do a research. Because that's how they do, that's why they do the studies, that they get big monies from the Rockefellers and the counterparts who say, do this research. But if we were to get the alternative Rockefellers, who would say, okay, be my guest, here's the money. Just and take people who have totally lost their cartilage and say, how do you grow it back? Then they would monitor and see, because when you give it, this is what I always say, even in people, that you will find, you will cut a person, you know, or cut yourself, even these operations that they do, you cut and then you stitch it. But then you find after a while you go and you remove the stitches. But what causes that flesh to grow back? Is it the stitches? It's not the stitches. It grows by itself.
It heals on its own.
You know, all you do, you give it stuff that it needs, like your protein, your certain types of protein, your amino acids, you know, your peptones, you know, those are amino protein essentials that help to grow something that had, you know, that is totally, you know. So the body is naturally capable of healing itself. And if that is the case, therefore, it's naturally capable of rebuilding something, because if that thing was there, it can rebuild it again. So it's just that we don't know. I mean, that is why you find that there are countries where you find there are people, I mean, I'll try and find this, these people who don't touch meat, who, even coming to this wear and tear, who don't touch meat, who only eat vegetables, and in winter they take apricot smoothies, because apricot is in abundance in their region, in their area. And apricot kernel, for instance, the pip of apricot is big on treating cancer. Now, in that region, everybody, it's not even known that there's something like cancer. You know, people who are doing these studies, it's the only country where it's not actually a country, it's a state, it's a village where people live off natural stuff, and they don't touch meat. At 65, they're still menstruating and they still falling pregnant. I'm going to find that and I'm going to show, just to show that this wear and tear that we're talking about is the wear and tear which is as a result of all the pollutions and the lifestyle and the food and whatnot that they are feeding us. Because even this thing that, I'm eating organically produced food, and they say even these cows that we are eating, they are fed human meat. You know, I'm actually going to pull that video and that whether it's AI or whatever. But these things that we are eating are poison. Then you wonder, Why must a person from that place where they don't touch anything that is unnatural, at 65, she's still menstruating? People reach up to, the average age is over 100, you know? Because that's how God had created it. So what I'm saying, therefore, is that these wear and tear, it's because of the poison that we are subjected to, which we cannot escape because that's where we are. You know, where are you going to go? If, you know, that's where we are. So this is where you can buy. This is what is available. So where else are you going to get that? Because even the planting that I'm recommending to people, you even wondering now, if you are even safe, if you are off the hook by planting your own food, because the seeds, where do you get the seeds? You're not getting them from the previous harvest that you had and you take. You're buying from these places, the seeds, and they will make the seeds themselves, GMO produced seeds or whatever. So the seed, then you're going to plant in there. Now the pollution, the pollution, because all they need is just to fly their helicopters all over, and all of a sudden we all suffer from COVID. And there's another COVID that is coming, by the way. I think you must just brace yourselves. I'm not scaring you, seriously. This is a warning, okay? Remember, I'm a Catholic, so lots of stuff that comes from our Catholic mystics, you know? So that's what we are subjected to.
Like many illness that get misdiagnosed, can arthritis also be misdiagnosed?
Yeah, it is very badly and largely misdiagnosed. I feel sorry, you know, when I look at the people and you see the suffering, especially the old ladies. They're suffering. I'm not saying, like I've said earlier with your first question, it is largely wear and tear, but there's a lot of misdiagnosis. Lots of misdiagnosis. And once, you know, because there's also inflammatory type of arthritis, rheumatoid arthritis, you know, so which is inflammatory, depending on what you eat or what is exposed you to inflammation. It may even be because of your what's going on inside your body. Then you are triggering inflammation, or so then you find you suffer from rheumatoid arthritis. Now that is another one that gets really bad. But if it is not detected to be rheumatoid and linked to inflammation, so that your treatment follows that, you're going to suffer. You know, you're going to suffer. So there's a lot of misdiagnosis in arthritis, Lorica. A lot. Both for the old and the young. And like I've said when I was mentioning a few areas of people that are having arthritis, that are on placement of arthritis medication. Most of them, the young ones, it's not arthritis. It may be hemochromatosis, it may be scleroderma, it may be calcification, it may even be basal ganglia calcification, because those with basal ganglia calcification, you find it affects the balance. Okay. And you find that we once had a lady here who when I told her what, and she said, I'm like that, because I remember Jackie, who was one of our consultants, she went with her to spa. And she said, she was just wondering, why is she walking like this? Because we're walking, and then she's walking on this side, and I'm walking on this side. Then I would find her walking towards me and bumping me. And then she would be embarrassed. And then she said she was walking like that. And I'm like, you know, so when I was telling her and she had basal ganglia. You know, basal ganglia affects the balance. Then you find, you know, and not only the balance, then you find the fingers. You know, those people with deformed fingers and, you know. So that's basal ganglia calcification, which is linked to thyroid, which most young people are suffering from, thyroid problems. Some it's Hashimoto, some it's overactive thyroid for whatever reason or whatever cause. So there are so many serious misdiagnoses of arthritis, particularly in young people.
Okay.
So if you are sitting with arthritis, you're taking medication, but you're just not coming right, you are not supposed to be sitting with medication for life. You are not supposed to be sitting with medication for life. So if you are sitting with medication, it gives you a little bit of relief, then you must go back again, then it's this, then now you are considering hip replacement. Or just come to us and then we'll be able to detect if it is arthritis in the first place. If it is, what type, what causes it, because even the wear and tear, like I've said, there are so many things that causes wear and tear. But these things can be reversed. They can be restored. Okay? So that's where we're going to end today. And I'm really emphasizing that you don't have to suffer quietly. You can come even if you're going to continue with your medication, but at least just helping you with supplements. That helps a lot. It's shocking people how effective it is, because now we're not just taking supplements just because your neighbor is taking this supplement. You take supplements that are appropriate for your own condition, even if it's bone, it's joints, but it's relevant for your own type of arthritis, if it is arthritis at all. So that's where we're going to end our show today. Thank you for watching, and goodbye.
Well, thank you, viewers. Just bring us to the end of another interesting topic, the health topic. So please stay tuned till next time. Thank you.